Hi everyone, I'm Garnet, physical therapist with Buffalo Rehab Group. I wanted to talk to you today about tightness in the hamstrings and tightness in the hip flexors and how they influence the spine. The hip flexors attach on the front of the pelvis. One of them also attaches on the lumbar spine. When they get very tight, they tend to tilt the spine into a position where our lumbar curve is accentuated. And with patients or people who have arthritis in their spine, that generally makes that arthritis worse, and that load over time can create things like stenosis and low back pain, even symptoms that travel down into the legs. So having tight hip flexors that really rotate that pelvis forward can exacerbate problems like that. On the flip side of the spine, or on the flip side of the pelvis, we have the hamstrings. They attach back here on the back side of the pelvis, and when they get tight, they rotate the pelvis forward into that forward tilt, and that can exacerbate something like an existing disc injury, a lumbar disc, or can contribute to a full-blown disc herniation. We want to stretch those structures on the front of the hip and on the back of the hip to make sure that they're adequate. If we think of them sort of like rubber bands, we want to make sure that there's equal force on either side of the pelvis. If the force is unequal, many times that can, again, exacerbate an injury or create pathology for an upcoming injury. Especially if you have a desk job, we know that these structures get tight while sitting. So I'll talk today about how to stretch them from your desk or how to stretch them when you're standing too. Obviously, you have a chair at work if you spend time sitting at a desk, and I like to use that in my patients here in the clinic so that they have something they can replicate the stretches with. So I'll show you what it looks like in the chair. So while we sit each day, we don't sit with perfect posture. Generally, we spend time in a flexed posture, and that puts a lot of stress on the spine. This position also shortens the hip flexors. It also shortens the hamstrings at their knee attachment. So one way we can stretch the hamstrings from a seated position is by extending the knee, sitting on the edge of the chair, and focusing on driving through the hip joint. So leaning forward into a hamstring stretch position for repetitions of 10 to 15, and doing that on an hourly or several hour a day basis can really help stretch those hamstrings out. Another way we can do that is standing with our foot on the chair this way, with toes against the chair, and just driving a nice gentle forward lean through the hip joint in order to encourage stretching of the hamstrings. One of the ways that we can stretch the hip flexors standing is with a foot on the chair like this and driving the hip forward towards the back of the chair in order to achieve a stretch on the opposite hip, or the hip of the leg that's back. Again, going through this position 10 to 15 times on an hourly or several hour a day basis can really help stretch out those structures that can remain tight on the front of the hip unless you do those types of stretches. If you want to try those at home or try those at work, I usually recommend repetitions of 10 to 15. Have a go at them and help present a run into our clinic.